According to the United States Census Bureau, in 2009, the divorce rate in the United States is around 50%. That means around 40% of children will experience divorce of their parents by the time they are 18 years old. Extensive research has been done over the past 3 decades by numerous fields of study to determine the short-term and long-term consequences and severity of divorce on children. Children of divorce display problems in all dimensions of health, including psychological, behavioral, or social, and physical. The aspect of health in children most impacted by divorce is psychological. A decline in psychological health can be seen in all ages of children. There is a 39% increase in incidence of mental health problems in children of divorce. Some problems that have been reported are less satisfaction with their lives, depression, anxiety, sense of rejection, sadness, and lower self-esteem. Girls from divorced families have a higher rate of depression than girls from married families, and boys tend to report more hopelessness and discouragement in relation to family stress. They may lose support systems that they depend on to help them through the divorce. Some kids are forced to move away from family, friends, church, family, teachers, and others that gave them the support they need. Children need to be able to go through the stages of grief also. The child can go through an emotional roller coaster and can spiral downward quickly, which can lead to depression, further depression that may have already existed, or lead to suicide. A decrease in psychological well-being and emotional stability can be expressed as behavioral or social problems. A variety of behavioral problems can be seen in children of divorce. Children from divorced families are 2 to 3 times more likely to participate in adolescent delinquent behaviors, such as conduct disorder, antisocial behavior, and difficulty with authorities. Boys tend to have a higher incidence of aggression and delinquency than girls. Adolescents are more likely from divorce are more likely to drink and use drugs more frequently and at an earlier age. They are more likely to have sexual relations at an earlier age, and the effects of teenage sexual relations and premarital sex can also affect relationships in their future. Academic performance tends to be lower and the dropout rate higher for children of divorce. They have lower scores in reading, math, spelling, placement in special reading classes, and lower grades. They also have lower educational aspirations and educational achievement, and has proven to affect them throughout adulthood. Adult children of divorce generally occupy lower occupational status, and a research done by the University of Virginia psychology professor E.M. Hetherington and writer J. Kelly, published in the 2002 book, For Better or For Worse, A Divorce Reconsidered. They show that children whose parents have divorced report feeling closer to the mother, which is also similar to their peers whose parents are married. The relationship with the father is the relationship that tends to suffer the most. Parental conflict also tends to contribute to problems with relationships even into adulthood. Along with psychological and behavioral health, physical health can be affected by divorce. Children of divorce have increased levels of stress, which can affect every body function. Children who experience divorce before the age 21 have a shorter lifespan and a 33% greater risk of dying than their peers at any age. Alcohol and substance abuse can also cause a decline in health and increase a risk of death by overdose or accident. Eating disorders or lack of sufficient funds to purchase food can be caused by the stress of divorce, and school-aged children tend to report more somatic pains such as headaches and stomach aches. Sleeping patterns may be disturbed, and lack of sleep can decrease energy levels, affect school performance and behavior. Younger children may regress to bedwetting because of the stress from the divorce. Self-mutilation may be a way that children tend to deal with stress, which can lead to infection or possibly death. Abuse is also an issue in family of high conflict because parents may express their anger on the child through physical, emotional, and/or verbal abuse. The effects of divorce are often short-lived and most children recover just fine, but some children, however, will live with the effects of divorce for a lifetime. Today I've just briefly covered psychological, social, or behavioral and physical problems children may display as a result of their parents' divorce. As we know, every child and situation is different and each child will be affected differently. Great research has been done to determine the effects of divorce on children, and research will continue on for decades to come. What we can do to help these children is to be an advocate and find the support they need to have a successful outcome.